Hello and welcome back to my channel. Today we're going to explore an incredibly common yet often misunderstood condition, cholelithiasis, or as most people know it, gallstones. Whether you've experienced that sudden sharp pain in your upper abdomen or your doctor mentioned gallstones during a routine checkup, it's important to understand what's happening inside your body, how to diagnose it, and the best ways to manage it. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Let's start with the basics. Cholelithiasis refers to the presence of gallstones, solid particles that form in the gallbladder, a small pear-shaped organ located under your liver. The gallbladder plays a crucial role in digestion by storing and releasing bile, a fluid that helps break down fats. But sometimes the substances in bile, such as cholesterol, bile salts, and waste products, become imbalanced, leading to the formation of stones. Gallstones can range in size from as small as a grain of sand to as large as a golf ball, and you might have just one or many. Interestingly, many people with gallstones have no symptoms at all. This is known as silent cholelithiasis. The stones are often discovered incidentally during imaging for another condition. But for those who do experience symptoms, the discomfort can be intense and at times debilitating. One of the most common symptoms is biliary colic, a type of abdominal pain that occurs when a gallstone temporarily blocks the cystic duct, which is the tube that allows bile to flow out of the gallbladder. This pain typically strikes in the upper right or middle part of the abdomen, often after eating a fatty meal. It can last from a few minutes to several hours and may radiate to the back or right shoulder blade. The pain is often severe enough to bring people to the emergency room, though it usually resolves once the stone moves and the blockage clears. Beyond pain, other symptoms can include nausea, vomiting, bloating, and indigestion. Some people experience a sensation of fullness or pressure in the abdomen, even when they haven't eaten much. If a gallstone becomes lodged in a duct and causes a more serious blockage, symptoms can escalate to fever, chills, and jaundice, which is yellowing of the skin. They can also have clay-colored stools. These are signs of complications like acute cholecystitis, where the gallbladder becomes inflamed, or cholelithiasis, where a stone moves into the common bile duct and obstructs bile flow. So, how is cholelithiasis diagnosed? The process usually begins with a thorough history and physical examination. A healthcare provider will ask about the nature of the pain, its location, duration, and what seems to trigger or relieve it. They'll also check for tenderness in the right upper abdomen, particularly under the ribs, a sign known as Murphy's sign, which can suggest gallbladder inflammation. The most commonly used imaging test to detect gallstones is an abdominal ultrasound. This non-invasive test uses sound waves to create images of the gallbladder, allowing doctors to see stones as well as any thickening of the gallbladder wall or fluid around the organ, which might indicate inflammation. Ultrasound is highly sensitive, especially for detecting stones within the gallbladder itself. In some cases, additional imaging may be needed. A CT scan of the abdomen can reveal gallstones and complications like abscesses or bile duct dilation. For a more detailed view of the bile ducts, a specialized test called a magnetic resonance cholangiopancreatography, or MRCP, may be performed. This MRI-based technique can detect stones in the common bile duct, which aren't always visible on ultrasound. Another diagnostic tool, particularly when a stone is suspected to be causing a blockage in the common bile duct, is endoscopic retrograde cholangiopancreatography, or ERCP. This procedure not only identifies stones, but also allows for their removal during the same session, making it both diagnostic and therapeutic. Once a diagnosis of cholelithiasis is confirmed, the next step is determining the best management approach. For people with silent gallstones, meaning they have no symptoms, treatment may not be necessary. In fact, many people go their entire lives without gallstones ever causing a problem. The focus here is usually on watchful waiting, where the gallbladder is monitored periodically, but no immediate intervention is required. However, when gallstones do cause symptoms, treatment becomes important to prevent complications. The most definitive treatment for symptomatic cholelithiasis is cholecystectomy, or surgical removal of the gallbladder. The most common method is laparoscopic cholecystectomy, a minimally invasive procedure performed through small incisions using a camera and specialized instruments. This approach has a shorter recovery time, less pain, and a lower risk of complications compared to open surgery. Most people go home the same day or after an overnight stay and resume normal activities within a week. In cases where gallstones have led to complications like acute cholecystitis, cholangitis, or pancreatitis, urgent surgery may be required. Sometimes, a temporary drain called a cholecystostomy tube is placed if surgery needs to be delayed due to severe infection or other health concerns. For people who aren't candidates for surgery, there are non-surgical treatments, though they're less commonly used. One option is oral bile acid pills, such as ursodeoxycholic acid, which can help dissolve cholesterol gallstones over time. This treatment works best for small stones and requires months or even years to be effective. Unfortunately, gallstones often return after this therapy is stopped. I just wanted to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any topics you want covered in future videos. Anyway, another non-surgical approach called extracorporeal shockwave lithotripsy uses sound waves to break up gallstones into smaller pieces that can pass through the bile ducts. However, this method is less effective than surgery and is rarely used in modern practice. After gallbladder removal, most people live completely normal lives. The liver continues to produce bile, which flows directly into the small intestine rather than being stored in the gallbladder. Some people may experience changes in digestion, such as a more frequent bowel movements or mild diarrhea, especially after fatty meals, but these symptoms typically improve over time. In terms of prevention, maintaining a healthy lifestyle can reduce the risk of developing gallstones in the first place. A diet rich in fruits, vegetables, whole grains, and lean proteins, along with regular physical activity and maintaining a healthy weight, can help keep the bile in balance. Rapid weight loss, however, can increase the risk of gallstone formation, so it's important to lose weight gradually if needed. For individuals with a higher risk of gallstones, such as those with a family history, obesity, or certain medical conditions like diabetes, regular checkups and early intervention can help catch problems before they become serious. That's it for this session. Thank you for watching. As always, take care of yourself and make the most of your day.